Hi, I'm Dr. Stephanie Van. I'm a Vietnamese woman with my long dark hair in a bun, wearing a gray Hopkins fleece, sitting in front of a colorful bookshelf with a bunch of disability advocacy swag on it. I'm excited to tell you about the talk I'm giving with some colleagues called Growing Pains, Best Practices for Vulnerable Pediatric Patients Transitioning to Adult Care. This talk is a great collaboration across multiple institutions. We've got Dr. Kavita Nandela from Kennedy Krieger. We have Dr. Anissa Tattini from Cincinnati Children's Hospital and Dr. John Fox from Gillette Children's Hospital, and me, of course. And we hope by the end of the talk, you feel comfortable summarizing the inequities that children face, especially when they're transitioning from pediatric to adult care, particularly children with disabilities. And hopefully you can also feel comfortable identifying some solutions to help your patients navigate these barriers as they become adults. So many children with disabilities face significant barriers and challenges as they transition to adult care. It's important to identify early the appropriate qualified adult level primary care and specialty providers that you'd want your patients to work with, and also social work and case management providers. It's important to educate and empower families and patients about directing and coordinating their own care. There are a lot of community activities that are inaccessible, which limits your patient's community participation. And there's a lot of inconsistencies with school-based resources and lack of access to resources after your patients graduate school. It's important to focus on helping your patients pursue accessible employment, consider insurance coverage limitations, and cultural biases like ableism. So some potential solutions to help your patients navigate these barriers are preparing for transitions early, well in advance, not once they hit 18 years old, but well before then. Help your patients and their families assess the goals of care, assess their financial means, insurance coverage, and availability of community resources. It's important to involve, educate, and empower your patients and their families while you're coordinating this care so they feel prepared to do this when they transition out of pediatric care and to adult level care. It's important to engage with social work, case management, and help maintain relationships with the appropriate qualified adult level specialty providers you'll be referring patients to. Our talk concludes with some tangible takeaways that you can immediately implement into your practice. These are things like inclusive language, words that you can use that signal to your patients that you want to offer them the most accessible and inclusive care as they transition from pediatric to adult level care. These can be things like words that are used in clinical settings. Instead of using outdated terminology like normal or wheelchair bound, it's more appropriate to say things like baseline or typical, or if someone's a wheelchair user. Because baseline or typical, everyone has a baseline, and you're usually working with them to maintain their baseline or work toward their baseline. And if someone is a wheelchair user, that gives them more agency, and you can also describe more helpfully if they're independent with wheelchair using, or if they need help with propulsion, or the type of wheelchair mobility they use, like if they use a manual wheelchair or a power wheelchair. These are tools that clinicians and providers can use right away to offer more inclusive care as they're helping their patients with disabilities transition from pediatric to adult level care.